discharge.
Which discharge? But you see, you want to ask all questions one person. We have only 1 hour.
No, like, I'm sorry, but at least tell me. I have that white discharge. It is kind of thick, odorless.
It's thick and odorless. Is it? Does it come? Is it daily, or it comes during a certain period and then disappears?
It can be on for like a week, then it goes. Then after it comes. Other times you see that mucus-like discharge, white.
You're going to...
Thank you, doctor.
Welcome. Our Wi-Fi on YouTube now. All right. Welcome back, my audience on YouTube. I'd lost you. Sorry about that. Very, very sorry. And I see you had even run away. Call your colleagues back. We are now back on YouTube. Sorry about that mishap. Yes, I see you're back. Thank you. I like you guys because you listen to what I tell you guys on YouTube. You're very good people. So let's run to your questions. Call those people that had already that had disappeared because my audio was bad. But we are back, and therefore I'll straight away go to your questions. All right. We have Madumita Mekereje on YouTube. You're saying after miscarriage, quick pregnancy tips, please. Quick pregnancy tips after a miscarriage. Now, what should I really tell you? But after a miscarriage, number one of the tip, because you people are interested so much, love tips. You love saying these are pregnancy tips, these are what. But number one, when you get a miscarriage, first allow at least 1 menstrual cycle for you to conceive. That is number one. Now, if you want me to call them tips, now that is number 1 tip. When you get a miscarriage, before you conceive again, make sure that at least 1 menstrual cycle has passed. Then number two, when you want to get pregnant after miscarriage, make sure that you've identified the causes, all the cause of the other previous miscarriage. We need to find out why the other miscarriage happened, because you may have a miscarriage, and if you don't manage the cause, then you may miscarry again. And therefore, the best thing is to carry out tests, identify what caused the previous miscarriages, or what caused the previous miscarriage. When you know what caused the previous miscarriage, it becomes easy for you to manage the current pregnancy, and you avoid or you prevent another miscarriage. Then if we've said number one, first allow 1 menstrual cycle. Then number 2, carry out investigations to identify what caused the other miscarriage, and then you can now go on and conceive. Another question on our YouTube viewers, someone is saying, my period is not normal. Ronel Godrich, you're saying your period is not normal. What do you mean by the periods are not normal? Please explain. What do you mean by periods are not normal? You don't, do you skip your menses? Okay, do you skip your menses? Rodri, let me know. Do you skip your menses? Do you have heavy bleeding? Do you have pain during bleeding? Because when you say you don't have normal periods, what will I really understand? Yvonne Gua is saying, hello doctor, hello. Okay. Rodri is getting, I want to get pregnant. Like Rodri, first tell me, Godrich, Ronald Godrich. First tell me, first expound on your question. This is Benta Monique is saying, hi doctor, all right, hi. Linda Morela, whoa, now that we are back, bravo. Okay, yeah, we are back. People have been missing you. The technical man has worked on it, but he had put us down. Our technical man is called Guestback, but he had put us down and our audio was down. Guestback Media, IT.next. You can go to his YouTube channel and subscribe. He always teaches people about IT. If you don't know how to use your iPhone, you have a problem, you want to learn how to use computers and so on, go to his YouTube channel. It's called it.next. Look for it and subscribe. If you can get for him 10 subscribers to this which we get for him 10 subscribers. it.next. Those on YouTube, let me write it for you. Spell it for me. it.next. Please look for that. it.next and subscribe to his channel. He always helps me with to make sure that you guys are on now. You see, I'd gone down. When he rectified everything, we are back. So YouTube guys, also support this gentleman. So we have Sia Kambe is saying, Doctor, I have one block tube now. How long should I get pregnant? Now, you see, when you have a blocked tube, I told you that first unblock that tube. And it's easy to unblock the tubes, okay? So if you have one blocked tube, just know that it may be difficult for you to conceive. By the way, why? Usually people will ask you, why is it difficult for you to conceive with one tube? It's because, remember, you're supposed to have two tubes. And each side of the uterus, that means both ovaries, the left and right ovary, produce eggs. And you may find that your left ovary is more active, or is more active than the right ovary. So if the tube whose ovary is more active is blocked, you'll have issues with conception. And therefore, I encourage you to first of all unblock that tube. But of course, like I've already said, the other one tube, if you have one tube, you can still conceive. There is no problem. But again, the chances will be minimal. I don't know if you've gotten me. If you've not understood me, you can ask your question again. This one is saying, Doctor, I have, okay, Jennifer Uzodinama. Jennifer Uzodinima, where are you? Where are you? Jennifer Uzodinima, where are you? Because which country is this? Uzodinima. I want to understand the country you're calling from. Hello, sir, normal for someone to see her period more than 5 to 5 years. Is it normal? It is not normal. I've already said that normal menstruation, the length of the menstrual cycle, the normal one is between 21 to 35 days. Okay? So if it's more than 35 days, it is not normal. It is not normal for a woman to have a cycle of more than 35 days. That is not normal, and it will be very hard for you to conceive. A cycle of above 35 days is abnormal. Purely abnormal. I think that is clear. Sia Kembe, which part of the world do you stay? Sia Kembe, I want to understand these names. When I hear Kembe, are you Kenyan? Let me know. Doctor, I have one block tube. I've already answered you. Sulaiman Ridwan Adewere saying, please, what the WHO range of normal sperm count? This one wants the WHO range of normal sperm count. You man. Now, of course, I've always told you about the sperm count. Okay. I've always told you about the sperm count, and I've always told you that the normal sperm count is between 15 million and 200 millions. Okay, so it's between 15 and 200 millions. So in a single ejaculate, when a man ejaculates, in a single ejaculate, a man will ejaculate between 15 to 200 millions. Some people even go to up to 300 millions. Men are very rich. Men are very rich creatures. In a single ejaculate, a man can go up to 15 millions. Okay? So every man out there, just know that you are very, 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 very rich. Very, very, very rich. A man can go up to 15 millions, but in some areas, some men have up to 39 million sperms. So the range I'll give you is between 15 to 39 million sperms. So every man out there, if you're normal, just know that you're very rich. 15 to 39 million sperms. Okay? Ronel is saying it comes 2 days. So you're talking about if It is normal to have menstruation of only 2 days. It is normal to menstruate for only 2 days. Very, very normal. So there is no problem about that. That's why you are saying your cycle is abnormal and I wanted details. So that is not abnormal. It is normal for someone to menstruate for up to 2 days. It is okay. When it doesn't go beyond 7, 8 days, it's normal. Some people even menstruate have only 1 day. So, Jennifer Uzodinima, you should tell us where you are. We need to know which country you are. But you're saying a woman to see her period more than 35, usually 35. Of course, I said it is abnormal. Ronel Rodriga, it comes sometimes beginning and then comes at the end of the month. Now, Ronel Godrich, I want you to understand this. I want you to don't base on the calendar month, okay? Do not base on the calendar month. When you see your periods like this, count it as day 1. This is what I want to tell every woman out there. We don't base. A woman will come and tell you, I see my periods twice in a month. It's abnormal, and they get confused around that. The issue is not all about seeing your periods twice in that calendar month. The issue is if you see your periods twice in a period of 21 days. If it is less than 21 days, that's when we call it, that's when it is abnormal. But seeing periods twice in a calendar month is normal. For example, if you are a 25 day, if you have a 25-day cycle and you see your periods on 1st, for example, you saw your periods on 1st of September, definitely you will see the next menses on the 26th. So you'll come and say, I've seen my periods twice in a month and it is abnormal. That is not abnormal. What we call abnormal is when the periods are less than, the length of your menstrual cycle is less than 21 days. That's when we call it abnormal. Then, another question, Dorini Tindimwewa is saying, what can be done to restore periods in polycystic ovarian syndrome women? Wow. By the way, one of the most difficult diseases to treat, to manage, is polycystic ovarian syndrome. Because this disease will cause infertility in the woman. And therefore, a woman will come, they want to get rid of the polycystic ovarian syndrome, but they also want to conceive. So it becomes a big dilemma. Now, some of the medicines currently we are using Rimona, we are using PCOS, it's PCOS, we are using PCOS, we are using Rimona, most of those medicines, they can be used. However, also depending on the weight of this human being that is having polycystic ovarian syndrome, we may try to use drugs like metformin. Metformin is an anti-diabetic drug, but it can also be used in that way. However, all these drugs I'm talking about, don't just use them without a doctor's prescription, because before you use these medicines, the doctor will have to carry out some assessment to confirm that you really need them. For example, you may be having a low blood sugar and you want to use metformin, that is not allowed. So, San Goddess is saying, I had 2 miscarriages last year, and since then I have not been able to get pregnant again. Now, can we know what caused those miscarriages? That is very important, because you may find that what caused the miscarriages is the current cause of your infertility. What caused the miscarriages may be the same reason causing the infertility right now. Therefore, we need to first carry out tests to confirm what caused the other miscarriages. Then number 2, you should also do what we call, I usually call it a fertility screen. A fertility screen involves imaging, involves blood testing. You do imaging as well as laboratory blood testing. Find out what is happening in your reproductive system, and then you can get treatment and conceive. There is no problem about that. Lydia Mushanga, this one must be Kenyan. Lydia Mushanga, kindly help doc. I don't usually have my period every month. They usually come after 4 months. Have been to the hospital, and last time I was on progesterone capsules, but it didn't help. Lydia Mushanga, let me know if you're from Kenya. This name is usually for Kenyans. If you are missing periods, what we call amenorrhea, I think I've already talked about this. Number one, have you carried out a fertility hormonal assay? That is very important. Very important to carry out a fertility hormonal assay. If you've been on progesterone supplements, should we assume that you are lacking in progesterone? It means, because before you start on these progesterone supplements, we must make sure that it is progesterone that is lacking. Otherwise, you may find that a woman has high levels of prolactin. And this usually happens because most people, or most of us, know that when you take progesterone pills, you can have your periods. The periods can resume, they can come back, they can come to normal. Yes, usually, right? But at times you may find that you have, the problem is your prolactin. You have high levels of prolactin, and you may need medicines to put down the prolactin. So, check that. You'll be required to carry out a fertility hormonal assay. Good evening, doctor. Doctor, please help me. I did a thyroid test. T3 is what? Now, you see, when you give me these values of the thyroid test, because these are thyroid, you did a thyroid test, and if you give me these values, I will still not give you an answer, because every laboratories have different reference ranges. Different laboratories have different reference ranges, and therefore, I would want you to specify, to give me a full report. In other words, for you, Susan Ayuba, you need a private chat. Please, for Susan Ayuba, just log into my website, www.druhthuman.com. Go book an appointment to have a one-on-one chat, because I want you to share with me the results and look at the levels of your hormone, the thyroid hormone and so on, and also look at the reference ranges. Ronald Rodriguez is saying, I have a child 12 years ago and I want to get pregnant now. Can you help me? I think Ronald Godric, I've already told you what to do. I think I've already told you what to do. You know what you're supposed to do, and that's what you're supposed to focus on. Okay. Sulaiman, read one at the well. Please, what are the ranges? I've already told you. Hello, Doc. Can one do egg retrieval at 45 years? Yes, it is possible and it is okay. Yes, it is possible and it is okay. Sun Goddess is saying, I live in US. My doctor has done blood tests and he said they found nothing wrong. So what's your question? They found nothing wrong. Which tests were done and what is the problem? Katwesi J. Oh, these questions are running away. Okay, I'll get to them. Don't worry. Today I'm here. I'm going to answer everyone's question as long as it comes within the time. Katwesi J. Dorini, saying half, so now it's 3 months. Now 3 months, my period, missing my period, and I'm 44. I stopped at 4. Now it's 3 months, missing my periods, and I'm 44. Have I stopped my menstrual at this age? Okay, it is possible, by the way, because usually menopause starts at 45 years. However, we have some people that begin menopause early, as early as 39 years, as early as 40 years, someone gets menopause. So it is possible. It is possible that you can have menopause at that age. Yeah, but however, you may also be having a problem, and therefore you can carry out tests to find out what the problem is. But again, if I can ask you, Katwesi Jedori, why do you want your periods? I may know the answer, but let me be sure. Why do you want your periods? Let me know. Let me know why you want your periods, because that may be the basis for the answer you want. Ronald Godriguez from Liberia. All right, you're from Liberia. Okay. Ben Tamunish, I have kidney cysts. Can it be the case because I have been unable to conceive? No. Cysts on the kidney cannot make someone fail to conceive, except if they have really enlarged, they are so big, they are causing compressions everywhere. That's when they can cause infertility. But a cyst on the kidney, no. Let it not be an scapegoat. Sulaiman read one at the way saying, I have 28 millions, but doctors say I have low sperm count. 28 million sperms, that is not low sperm count. That is not low. It is normal. Maybe you may, by the way, this is an issue. You may be having the quantity may be okay, but the quality. You have 28 million sperms, however, they are non-motile. You may have 28 sperms, but they have big heads. Big sperms with big heads cannot fertilize. Sperms with big heads cannot fertilize an egg. You may have 28 million sperms, but they don't have good tails. They have short tails or very long tails. Sperms cannot swim. You may have 28 million sperms, but when they are dead, when they are not live. So you may have all that million sperms, but they are not progressive. Their motility is poor. The vitality is poor. So, of course, when you are doing, check on one of my videos. I think you need to check, read well. Check on, this one is called, read one. Check on one of my videos where I was teaching about how to treat low sperm count. That video is there. Check in one of my videos where I talked about how to treat low sperm count. I described the qualities of sperms and how they can be managed. Any disorder can be managed. Lynette Anyango on YouTube, you're saying, hi, I went for HSG and I found that I have proximal tube blockade. And the guy told me it can't be unblocked, that I have to stay like that. Doc, please say something. Wow, I will not comment about what the gynecologist told you, but what I know is that blocked tubes can be unblocked. Using several means, you can use laparoscopy, you can use cannulation, you can use the flushing, and so on. So there are several, even surgery itself, opening opening the uterus, and then you go in direct. All those means, but of course, now that depends, because some people may make decisions depending on your age, and also some other factors they have found out. But to give a direct answer, blocked tubes can be unblocked and it is done surgically. There are no medicines that can be given, but surgical measures can work. Blessing Ebiri, how are you? You're a usual viewer of our channel. Blessing Ebiri, please doctor help me. I see my menstrual cycle on 5th September. And I have not seen it again till now. And I have done a pregnancy test and it is negative. What should I do? Blessing Ebili, I think 5th September is when you saw your periods. And today is 5th of, what is the length of your menstrual cycle? Because it may be normal for you. So let's first know what the length of your menstrual cycle is. But again, how long have you spent without getting pregnant? Let us know that. Jennifer Uzodinima, hello doc, I have been trying to conceive for the past 2 years now, and period is not regular. I had yeast infection and I have treated it, but my period is not regular. Yeast infection cannot cause irregular menses. So the cause of your irregular menses is not the yeast infection. Of course, definitely the yeast infection must be treated first of all, to be normal, and 2, they can also cause some infertility somewhere, somehow. But yeast infections, and I know when you talk about yeast infections, meaning candidiasis or candida, that cannot cause irregular periods. What causes irregular periods may be mainly 2. Number 1, it may be an issue with your hormones, and number 2, you may be having some masses in your uterus. So work around that area, Jennifer Uzodima. Ronel Godrich, can I take prenatal tablet without doctor's prescription? Prenatal tablets, they are there, they are available without even a doctor's prescription. But before you take them, just make sure that you're taking them for the good reasons. Because some of you will take them, like you're planning, you want to conceive, and that's the reason why you're taking these medicines. You have infertility, you have blocked tubes, you have a problem with your hormones, and you're taking these prenatal medicines. So the best thing would be to go to the doctor, confirm whether these are the right medicines you're supposed to take, and then you can take them. Lydia Mushanga, I'm Zambian. Hey, I thought Mushanga is Kenyan. You're from Zambia. All right. Mutoni Angelique, hi Doctor, hi. Okiring Moses, Doctor, my wife receives her periods in every 26th day of every month. So help me know the ovulation days. So the 20, okay, all right. So the length of her menstrual cycle is 26 days. Okay, this is easy. Let's calculate it for you. Let's calculate it for you. If you want to know your ovulation day, okay. So if the length of your menstrual cycle is 26 days, now we shall say, I want you to be giving me answers here. L minus 18, what do we get? You should be giving me answers. If you didn't do mathematics, then just know that you're going to fail here. So which answer do we have? Sorry. I'm asking for the answer when I've given it wrong. 26 minus 18, what do we get? I want answers here. 26 minus 18, what do you get? So 26 minus 18, someone is giving me an answer. So we get 8. Okay? So you have 8. Now, 8 plus 4, what do you get? Someone give us answers here. 8 plus 4, you get 12. Yeah, thank you. We get 12. Then 12 plus 5, what do you get? 17. Now, the ovulation day for your wife is this. The 12th day. So on this 12th day, that is when there are very high chances of her conceiving. From 1 to 8 days, she's safe. Those are her safe days. Not 1 to 8, 1 to 7. So from the first day up to the 7th day, she's safe. From the first day up to the 7th day, here, even if you have unprotected sex, she cannot conceive in those days. Then from the 8th up to the 17th day, these are fertile days. All those days she can conceive. From the 8th up to the 17th day. And then from the 17th day up to the 26th day, all up to, until when she sees her periods, she cannot conceive. So the answer is 12. So if 12 is the day she will have her ovulation. I think your question is now clear wale. Mutoni Angelique is saying a person with polycystic ovarian syndrome. You're saying a person with polycystic ovarian syndrome, because using birth control after using metformin and letrozole are not pregnant, can you drink cloves, sination, tea, and get pregnant? Mutoni Angelique, the only problem is that I'm not a herbalist. I am not a herbalist. I am not a traditional doctor. Therefore, these herbal drugs, cloves, cinnamon, and so on, green tea, and so on, I can't comment about them because for us in medicine, we do what they call evidence-based medicine. We use evidence-based medicine. Before something is used, before we give you a drug, we have to first confirm that the drug works. And those drugs pass through processes. We pass through processes. Number one, if you come out today and you're a scientist and you tell us that this drug this molecule can treat malaria. This molecule can treat this. We first tell you go to the laboratory. Let us test this medicine on such and such a disease. If it works in the laboratory, then we tell you now start doing trials, clinical trials. You start doing trials on lower animals. You do trials on lower animals like rats. That's why students in senior 6, those doing biology, they dissect rats, they dissect cockroaches, they dissect frogs or toads. Okay, so because so during these studies, we test this drug on those animals, lower animals. If this drug is able, can treat that disease in those lower animals, we now move to higher animals, the likes of the primates and so on. Then from there, we can now take the medicines to vulnerable people. Then after that, we can now take the medicines to a larger population. And then during that time, we are looking for the side effects of the medicines. We are looking for the interactions of those medicines. And then now medicines can go into the circulation. And we can confirm that this medicine, for example, paracetamol, can really put down the temperatures. So before we do that, we cannot confirm. Now, the problem I have personally, and I will say this is my personal problem, the problem I have with the herbal medicine is that the drugs are not researched. You find that if I am a herbalist, I'm the only one who knows this drug I'm giving you. Because you see, even with the herbal medicine, if you go to another herbalist, they don't know the drug the other person gave you. But for us in modern medicine, if I give you a medicine, and you take it to another doctor, that doctor will definitely know that this is Panadol, this is Coartem, this is a PCOS, they will understand this is aspirin, they will know that this is the drug. And even if you get a problem, that other doctor can treat you because the medicine is known. Even if that one does, if they ask, everyone knows that this drug treats this, it has A, B, C, D side effects. But the problem with these herbal drugs, the person who has given you that medicine is the only one with the knowledge. So we usually tell them that please let us also know. Because you can't tell us that you're the only one with the knowledge of that drug. So if you get a problem, you give a drug to someone, the person gets a problem, and for you cannot help him. What shall we do? Because we don't know exactly which chemical was given. So that's the reason why I don't deal with herbal medicines. I don't deal with those drugs because we do not know the chemical formula there. Someone comes up, because with some of these herbal drugs, herbal medicines, someone tells you it is my grandfather used to give people this medicine and they get pure. So it's also the same medicine I'm giving people. So what I tell you is that let this medicine be brought to the laboratory. Let's go and test which chemical component is contained in this medicine. How does it affect the body? Any interaction with other drugs, and then we can now accept and say this drug works. Other than that, we don't. So modern medicine, we do evidence-based medicine. Another question is from Sulaiman Ridwal. All right. Odunayo Miriam, you're saying, Doctor, please, I have been trying to conceive from 4 years now. What can I use? Now, before I tell you what to use, first of all, how old are you? Which problem do you have? Have you carried out tests to confirm the problem you're having? Why are you not able to conceive? First, carry out tests. Okay? So before I cannot tell you the medicines to use, but I will tell you to go to the hospital and carry out tests. Do for me the following tests. Go and do a scan, the usual ultrasound scan. Number 2, go and do for us a fertility hormonal assay. Make sure that you don't forget progesterone, estrogen, prolactin, luteinizing hormone, follicle stimulating hormone, estradiol, and AMH. Make sure that you do those tests. Then also go and do an HSG X-ray. Then when you have those results, we can talk. Kamasco is saying, after 7 months without periods, saw them in the 8th month. What could be the problem? The problem is likely to be hormonal. It is likely to be hormonal in nature. And the hormone that may be affected is usually progesterone and prolactin. Edina Devi saying, hi doc, my blood group are the same as my husband. Will I get the baby? Will we get the babies? Yes, it is okay. Actually, it's even better for you to have the same blood group. It is better to have the same blood group with your spouse. When she gets a problem, you can donate blood. When you get a problem, she can still donate blood to you. There is no problem. People with the same blood group, it is okay. You can marry yourselves. It is okay. You can conceive. There is no problem. Again, still concentrating on these questions on YouTube. Rachel Iliwick, you're saying, hey doc, I am 43 years, my cycle is 31, 32. The last period was on September 20th. When if my fertility day and I need a girl? Oh, let me get your question clearly. Rachel Iliwick is saying, hi doc, I am 43 years, okay? My cycle is 31, 32. The last period was on 20th September. When? Okay, you're looking for your fertility days. All right. So if you have a 31, 32 day cycle, we shall consider 31 as the length of your menstrual cycle. Let's calculate for you your ovulation day and the fertile days. Let's calculate for Rachel. Let's help Rachel know her fertile days. Let us help Rachel know the days she can conceive, know her ovulation day. Okay, Rachel, here is the theme. Rachel, here is the theme. We shall take the length of your menstrual cycle as 31. Because remember, we choose the shortest, okay? As 31. So, we shall say 31 minus 18. What do we get? I need answers. Those of you following, 31 minus 18, what do you get? I will not give you an answer when you don't. You should also participate. 31 minus 18, what do we get? Someone is saying we get someone is giving me 13. Is it 13? Should we use 13 as someone is telling me? Okay, so 31 minus 18 is 13. So 13 plus 4, what do you get? 13 plus 4, what do we get? I will not answer. Someone has to give me an answer. Yes, Movuto Nyirango, okay, thank you. Okay, 13 plus 4, what do you get? Let's help this person. Okay, yeah, someone is giving us 17. So 13 plus 4, you get 17. All right, thank you. 17. So 17 plus 5, what do you get? 17 plus 5. 17 plus 5. Okay, 22. Thank you. So now, who asked the question? Okay, who asked the question? Okay, so if your cycle is 31 days, from day 1 up to day 12, you are safe, you cannot conceive. From day 13, you can conceive from day 13 up to day 22. Your ovulation day is on the 17th day. So, whoever has asked the question, this is the day you can highly conceive. This is a day you can conceive, that is the ovulation day, but still from 13 to 22, you can conceive. Okay? So, do it like that, you will know how you can conceive. I think you're clear. 13 to 22, those are your fertile days, and you can conceive around that area. Okay. Let's go to another question. Time is running away. Time is running up. Okay. Alright, so those on TikTok, we are only left with 5 minutes. After 5 minutes, we shall be. I want you to all switch to YouTube. That's where we shall be answering all the questions. So in 5 minutes, we shall be switching to YouTube, and then YouTube we shall have more 15 minutes, and then we close this session. Okay, so this person asked a question, and I'm still looking for it. I'm not getting the question. All right, let me go to some other questions. Hi doctor, this one is called Khadija D saying, hi doctor, is it okay for a woman who is trying to conceive to take zinc, vitamin E, omega-3, soft gel, and folic acid all together? If yes, can she take them on a regular basis until she gets pregnant? It is okay. By the way, it is okay to take those medicines. It is okay. But of course, let me be sure that these are not the medicines you want. You're not taking these it's like, because some of you will take these medicines even when you have another problem. You have your hormonal imbalance and you're taking this medicine. Okay? So, but it is okay. These medicines are good. They are good for the reproductive system. So it is okay to take them. Doctor, my wife, okay. Hi doctor, my blood group are the same. This is okay. I answered this question. Okay. For you're saying my period is irregular and I was recorded 6 months cycle, but I didn't conceive. What do you mean? What's the question exactly? I don't get your question. Lydia Mushanga is saying, I did the test for testosterone and is 1.83 that progesterone. Lydia, you see, when you give me these results, I will not understand you clearly. I will need, if you're giving me these results, you have to also give me the reference ranges. So we shall have to say bye-bye to those of you guys on TikTok. Thank you so much. You've been a very good audience. Let me first remain on YouTube. Those of you on TikTok, please go to YouTube. That's where we are going to answer all these questions. Sign out on TikTok and remain on YouTube. Bye. Till next time. Okay. So let's continue with our questions on YouTube. You guys are a very good audience, and you are always you support me, and I like you so much, those guys on YouTube. So let's continue with you. TikTok is a new app for me. I don't even know how to use it, so I go there a little and then come back to you guys, my main audience. Muton is saying, I have been using Litrazole, metformin for 7 months, but I'm not pregnant, and I have not used birth control for a year and 4 months. What should I do, doctor? Muton, what is which problem do you have? What is your problem? Let me know what your problem is. You always ask, you ask questions, but you don't bring out exactly. Maybe, I think I would, okay, just be clear. Because you're taking metformin, is it that you have polycystic ovarian syndrome? Why are you taking metformin? You might have told me some time back, but I may not be remembering. Mabuvuto Nyirongo is saying, I did a scan today and found I have fibroids, 5.9 by 4.1. Can they cause me not to conceive? Yes. Mabuvuto Nyirongo, which country are you? Mabuvuto Nyirongo, which country are you? But fibroids of that size can cause you not to conceive. Yes, that is true. Lynette Anyango is saying, doctor, the gyno I went to see told me that my tubes are blocked. The gyno I went to see told me my tubal blockage was caused by serious infection that I had been experiencing. Can antibiotics I was given open them? No. The antibiotics you are given can treat the infection, okay? However, if there is already a blockade, that blockade cannot be treated by antibiotics. I think that one is clear. Kelechi Shedrack is saying, good evening, doctor. When ultrasound scan results of a pregnant woman displays that the cervical bone is closed, what does it mean, and how can it be corrected? cervix being closed. That can be, I'm not so sure about the size, how long the closure is, like how further does the closure go, but can have a condition called Asherman's syndrome, all just abbreviations, okay? So that can be treated surgically. You surgically enter and open the cervix. Please, doctor, my cycle do change. 24, 25, 28, 26, 20. Is it normal? No, it is not normal, especially when you have 20. If it was up to 21, it would be normal, but 20 is not normal. Hi, doctor, anytime I will come to meet you in Masaka. All right, you're welcome. How did you know that I'm in Masaka? Joy Kelly saying your phone number. I'm sorry, I've always said it here. I don't give out my phone number because if I give it out to you, you are very many. I think if I give out my phone number, I will not be working. Every time you guys will be calling me and I will not be able to work. So if you want to have a chat with me, just book an appointment. Like you see my website, it is there. Book an appointment, they will give you a day. We meet and chat. So just book an appointment on the website. You can chat online and get your problem solved, or you can just come to the hospital and get treated. Khadija Kalechi, can a woman with such a scan, closed cervix, be able to give birth without a C-section? Of course, the first thing is how will this woman conceive? Because if the cervix is closed, it may also be hard for someone to conceive. But of course, they can conceive. Maybe if it is blocked, but there is still some small path. Conception may occur. Giving birth normally, no, of course, the cervix has to first be opened. So that woman may be advised to do cesarean section. However, the cervix can still be surgically opened, like I said. Khadija D saying, hi doc, is it okay for a woman who is trying to conceive to take zinc? Yes, I said it is okay. I answered this question. Okay, Namiro Ram, doc, my cycle has been 28 days for some good month, but now it has said 24 days. What has caused that? For hormonal fluctuations can do that. I think that is clear. Mobuto Nirang, alright. Apio Winnie saying, doctor, my husband has 0 sperm count. Can I really get pregnant with him? No. Pregnant with him, how? 0 sperm count. How will a person with no sperm make him pregnant? Maybe if you try to, some women, I'm not saying you, but most women, or let me say some women have those plans. When they confirm that you're not able to conceive, they try someone else. They try your brother or someone else. And that's why, of late, you've been seeing many people doing DNAs, and DNAs done out to be negative for the men, for the husbands that those women are with. And that could be okay. So, 0 sperm count, you can't make a woman pregnant. Okay. Another question here is saying, doctor, okay, I've gotten that. Doctor, I need your number. No, I don't give out my number, and I've always given the reason because you guys are very many. If I give out my number every time, I'll just be answering calls. So I don't give it out, but just book an appointment on my website. It's clear, www.druthman.com. Book an appointment, they will give you a time, the day and time when we can chat. Joy K, if you have fibroids, can you be pregnant? Some women can conceive with fibroids, though many, the highest number, will not be able to conceive. So fibroids can cause infertility, but of course a few women can even conceive with fibroids. Okay, now answers are flowing. Okay. McQueen Uzu is saying, after 6 months, my cycle have not been in the same. After 6 months, my menstrual cycle have not been in the same. I normally see it on the 13th, or sometimes it comes on 14th. Please, McQueen Uzu, if you want to, because probably what you want to ask, you want to find out the length of your menstrual cycle, you want to know whether your cycle is regular and so on. Just count for me. When you see your periods like this, the day you see your periods, count it as day 1, and then the next days, the next day, if you see your periods like this, that is day 1. Now when you see periods again, that is another day 1. So count the days in between and give us the length of your menstrual cycle. That's how we can be able to help you. Is super. Joanne is saying, hi doctor, it's now 2 years and a half when my menstrual periods changed. I received low menstrual flow, even the first day, whereby the flow is supposed to be high. So what is your question? Okay? But still low, even the sanitary towel can't get filled. What could be the cause? That is hormonal, it is hormonal fluctuation. You may be having a hormonal imbalance or fibroids. Do tests to confirm what is causing the problem. It's likely to be, you're likely to be having a hormonal imbalance. Okay? Do a fertility hormonal assay. That's what I can advise. Comfort Musa, I think we are left with only 5 minutes or to close off YouTube also. 10 minutes. Guess about it. You love YouTubers. Okay. Alright, so we are left with 10 minutes for YouTube. I have Comfort Musa, I have a 28-day cycle. What's my ovulation day? Your ovulation day? Alright, 28-day cycle. 28-day cycle. Let's calculate this. 28-day cycle. I'm calculating for a 28-day cycle that is irregular. Okay? If it is regular, 28-day cycle. This is simple. 28 days. L equals 28. If your cycle is 28 days, just do 28 minus 18. What you get? 28 minus 18. What you get? You get 10. Okay, someone is giving me the answer. You get 10. Okay, so if you get 10, then get 10 plus 4, you get 14. 14, this is the easiest. 14 plus 5, 19. So whoever has the menstrual cycle, if your menstrual cycle, the length of your menstrual cycle is 28 days, you are safe from the day you see your periods. The day you see your periods, you are safe. You can have sex as many times as you cannot be able to conceive. So you cannot conceive from day 1, the day you see your periods, up to day 10, up to day 9. Day 1 to 9, you can't conceive. Then from day 10 to day 19, you can conceive. Those are fertile days. Okay? Those are fertile days. But of course, your ovulation day is on the 14th day. On the 14th day is the day you can highly conceive. There are very high chances of you conceiving. So, I hope I've answered your question. You're saying, I have a 28-day cycle, and my the ovulation day is on the 14th day. So, your ovulation is on the 14th day. Okay. Niwabine Poti Yalusi, hi doctor. 32 cycle, which days am I fertile? I think I've already calculated for a 32-day cycle. I did a 32-day cycle. Was it 31? If it was, yes, I did it for a 31-day cycle. So just go on adding 1 for a 32-day cycle. Or anyway, you will say that I did work on specifically. Let's also do it. Let's do it. A 32-day cycle. 32 minus 18. Which answer do you get? You get 12? 14. Okay. 14 plus 4, you get 18. Okay. 18 plus 5, you get 23. So your ovulation day is on the 18th day. So 18th, when you see your periods, count 18 days. The 18th day is your ovulation day. I think your answer is clear. Good evening, doctor. I have a 29-day cycle. Oh my God. 29-day cycle, like we calculate for a 28-day cycle, just add 1 day on each of the answers you got. So which means your ovulation day is on the 15th day. Okay? Your fertile days begin on the 11th day. So 15th day, that's when you can conceive. High chances of you conceiving. Alright, trending news. Good evening, doctor. I have a 29-day cycle. I think I'm free. But I noticed that I don't ovulate when my fertile app says I'm ovulating. My LH surge peaks a day or 2 days after the app says I'm ovulating. Is it something wrong? You see, I don't usually talk about these apps because some people don't know how to use these apps, and some of the apps have errors. Okay, so I will not so much talk about the app, but what I know, if you have do it naturally. If you have a 29-day cycle, you have a 29-day cycle, just know that your ovulation is on the 15th day. So count on the 15th day. Don't mind about what the app is telling you. 15th day, that is your ovulation day. Natamba Irene, Lini said, Doc, my menstrual blood today is black and I have been trying to conceive, but no way. You see, black menstrual blood may not be the one causing making you fail to conceive. It may be something else making you fail to conceive. But what I encourage you is to carry out tests, okay? Carry out fertility tests, fertility screen, do pelvic ultrasound scan, do hormonal assay, do HSD, find out why you are not conceiving. How many minutes are left? 5 minutes for us to conclude. Let me have this question. Trending news is saying, I am also currently breastfeeding but trying to conceive. My period is regular. You see now, you're confusing yourself. Trending news, you are confusing yourself. Trending news, you are confusing yourself. You want to conceive and you are breastfeeding. First win off that child. Because you know that most women will not conceive when they are still breastfeeding. You know that breastfeeding is part of the family plan, the natural family planning methods. What we call breastfeed. In other words, someone may fail to conceive because they are breastfeeding. What we call lactation. Okay? When someone is still breastfeeding, they may not be able to conceive. So you're right now, you want to conceive, but you're still breastfeeding. So the first medicine I will give you is to stop breastfeeding. That's the first thing. Then we can now plan on other things. Doctor, do you do tubal and blockage in your clinic? Yes, I do, and we do. Good day, doctor. How about a 23-day cycle? Okay. A 23-day cycle. 23 days. You'll say you do 23 minus 18. What do you get? You get 5. You get 5. 5 plus 4 equals 9. And 9 plus 5 is equal to 14. So a person with a 23-day cycle is fertile from day 5 up to day 14. The ovulation day is on day 9. Other days are same, you can have sex and no conception. Alright, we are winding up. Good evening, doctor. Please, I have 26-day cycle. When is my ovulation? I've already done a 26-day cycle for you. Then this should be the last question, I think. Good evening, doctor. Please, sir, I mean my date is on the 13th, but after giving, my date is changing. What is your question? I don't get your question, please. I don't get your question clearly. Okay, so I think we have to close this session today. Thank you so much. You've been a very wonderful audience. And I've already told you, if you'd like to get in touch with me to have a private chat, a private conversation, go to my website, www.drkuthman.com. Book an appointment. We shall talk, we shall chat, and have a way forward to your problems. Also, become a member of our channel by pressing join. Join our channel and become a member. You'll have a lot of benefits which we shall be introducing to you when you become a member. And those of you who have issues with your computers, your mobile phones, your laptops have issues, you have a problem with your phones, please subscribe to it.next. it.next, that YouTube channel will be able to teach you how to manage your phones. If you have a problem, you want to download something, you don't know how to do this, anything related to IT, go to it.next, and that is the guy we work with to give you this broadcast. Thank you so much, and have